Hi everyone, welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute here in downtown Chicago. And today's episode we are going to answer the question, why does concussion rehabilitation have to be unique to each individual? And this is an important one because concussion rehab is a lot of times put into the category of, especially medical doctors, as we can't do much, we need to have people rest, and we just keep telling people to rest because we can't necessarily treat them without resting first. And I disagree with a lot of that. I think rest is generally not good for concussions. Of course, sometimes people have other issues where they need to rest first. But at the same time, concussion rehab involves many factors because everybody's brain is different. We develop a little bit differently than our peers or counterparts. We also, with a concussion, we have different injuries or different lesions, different parts of the brain. We can have like general statements of like general aerobic exercise is pretty good for people. Hyperbaric oxygen therapy may be good for people. Some meditation or vagus nerve stimulation may be good for people, but that doesn't make it a unique treatment for a specific individual. And so we're going to talk about a paper that's, again, relatively new, that is looking at a different approach to how we can be very precise. We can look at our treatment in a specific way to be precise and hit the exact areas of the brain that we need to hit, and therefore also address all the problems that we need to in concussion rehab or neurological rehab for TBI or post-concussion syndrome. And so let's look at this paper. It is from Frontiers in Neurology, and it is a review paper from May 2019. And it's called Network Analysis and Precision Rehabilitation for, I'm sorry about that, Network Analysis and Precision Rehabilitation for Post-Concussion Syndrome. And so let's look at the abstract first. Basically, post-concussion-like symptoms are caused by many factors, both before and after the MTBI, the mild traumatic brain injury. So the factors before, like whether somebody has low-level anxiety or a stable environment at home, that can really affect the outcomes of mild traumatic brain injury after the concussion, after the hit. And this non-specificity is the bedrock of the conundrum regarding the existence of post-concussion syndrome. So the big motto is it's a biopsychosocial conceptualization, meaning that there's a biological process, like within the brain there is an issue, then a psychological process, whether that be the theory that having a brain injury is a problem or just not being cognitively there, and the social issue where people may feel neglected, they may not feel like they can function socially with their friends, family, and therefore it continually puts people on a downhill slide following a concussion. So this guy, Grant Iverson, is proposing a new perspective, a network perspective, that symptoms co-occur because they are strongly interrelated, they are activating, they are amplifying, and mutually reinforcing each other, not because they arise from a common latent disease or entity. Basically meaning that it's not all just one specific spot in the brain that is causing everybody's symptoms, whether that is this one spot in the brain is causing the sleep issue, the headaches, the anxiety, the depression, all at once, maybe the visual issues, whatever it may be. Instead, there are these interrelating symptoms that, yes, it may be a specific part of the brain that's injured, but there's these other relationships, other factors all around that are perpetuating or amplifying these. So again, he says symptoms do not arise from an underlying syndrome, but the symptoms are the syndrome, okay? So the promise of rehabilitation, the precision rehabilitation, requires us to better understand these interconnections among symptoms and problems so that we can produce more individualized and effective treatment rehab. And so let's just go right into this picture here. So this picture is the personal biopsychosocial context. So going into a concussion, we have all these different factors. First of all, we may have, let's talk about the symptoms first. So physical symptoms. We can have nausea, body pain, balance, dizziness problems, neck pain, visual difficulties, sleep disturbance, migraine, sensitivity to light and sound, ocular motor problems. So these are all symptoms, physical symptoms. We have psychological symptoms, anxiety, nervousness, anger, irritability, sadness, depression, hopelessness, traumatic stress, maladapting coping behavior, right? And then cognitive symptoms like slower information processing speed, poor attention, concentration, executive planning difficulties, memory difficulties, reading difficulties, and comprehension issues. And this is where he is saying that these symptoms perpetuate, amplify one another. For instance, if somebody has light sensitivity, headache, they may have problems with reading comprehension, difficulty reading and processing speed because they can't handle working when they're in pain. They can handle working on a computer when they have light sensitivity. This may then lead to anger, irritability because they're not doing well in school. It's going to lead to depression because they're not doing well in school. These are just perpetuating and ongoing with one another. But at the same time, people have these different stressors outside of their environment that may be affecting them before the concussion or after the concussion. So we have environmental stressors. These could be just like overreactivity to toxins like BPA, other chemicals. It could be even diet related. Orthopedic injuries. So like if somebody's going to have a hard time recovering from a concussion if they have a bunch of broken bones due to maybe a car accident or a skiing accident. And then social psychological factors, whether this person maybe is a high school athlete and is the star of the team, and has a great support program, that's fantastic. He might do better following a concussion versus somebody who maybe is the star of the team, great athlete, but not a good support program, and now parents are upset that he's not going to get a scholarship or something like that. Other health problems they may have, some pre-injury vulnerability factors. So this could be a lot of things. Again, not being in a good home environment, other stress, maladaptive, adaptive personality characteristics, and then an evolving pathophysiology. So basically, where the pathophysiology of the concussion is continuing to get worse, or there are other factors involved with the patient's brain, with the patient's body. Okay. So the adaptive personality factors that they list here is like resilience, grit, passion, perseverance, like psychological hardness, like how well are they able to do things. Okay, so then, another environmental stressor I forgot, financial, occupational stress, academic stress. So people that can't work because they have, they're dealing with concussion, they can have a lot of financial stress. So, okay, and then we're gonna go to one more photo here. Let me move myself. Okay, so this is kind of like a network rule here. So we have, different things here, whether it's headache, H6, sleep, S5, fatigue, irritability, concentration problems, light sensitivity, dizziness, nausea. Okay, so basically all of these symptoms here may be perpetuating one another or amplifying one another. So for instance, like anxiety can cause nausea, anxiety can cause concentration problems, can cause headaches, can cause irritability, can cause, sorry, I forgot what D and L were. Dizziness is D, L is light sensitivity. Okay, so anxiety can cause all of these things, or perpetuate them if somebody has, let's say, already have some irritability and then the anxiety picks that up. Already have the headache, and now the headache causes more anxiety, and the anxiety causes more headache. And it just goes round and round, back and forth. So we have this network in play. And so, like, we have to understand when we are treating patients with post-concussion syndrome, what is the main cause? What do we really have to hone in on first? Even though we are trying to treat all these symptoms at once, we are trying to localize an area in the brain to fix and to therefore improve that person's anxiety. If that person's anxiety improves, then their headaches will be less, or their concentration will be better, their fatigue will be less. And so that might be one specific node that we're working on, but at the same time, we're working on decreasing that patient's headache. And decreasing that patient's headache can also benefit their anxiety, can also benefit their concentration problems, their irritability, their light sensitivity, all those things. So it's really this network that when we're fixing, as we're fixing one problem, that should help fix another, because these symptoms are amplifying one each other. They're interrelated. Then at the same time, this is more all our realm, but then we also have to work maybe with other practitioners, or we have to work with social workers, or we need to talk to our patient to understand, okay, what is the academic stress they're under that is also increasing these factors. I just had a patient that had a lot of financial stress because she was out of work, and so she had to pull back from therapy a little bit because she couldn't handle getting into more debt. That was causing a lot of anxiety. So taking out that therapy really improved this stress, that decreased some of her anxiety. And she was able to do things at home and then slowly improve. Social stress, that's another one. So again, social stress of not being able to fit in, maybe not being able to play a sport they want to do, not being able to go out with friends, that can also cause a lot of these problems. And so we need to be able to discuss these with our patients. We need to be able to get them to other practitioners that might be able to help them more at the same time, because this is a multidisciplinary problem. This is a problem that is involving many factors. And so just like if there are many factors involved in a brain injury, then we have to utilize all these factors to have this precise treatment, precise rehab treatment to improve the patient's goodwill, well-being, and be better off. So that is all I have for today. I thought this was a really important one because it really shows how every concussion is different, every individual is different, and therefore everybody should have an individualized, precise treatment plan for recovering from a post-concussion syndrome or recovering from a concussion. So if you have any questions or comments, I would love to hear them. If you have any suggestions for future topics, please leave them below. Thank you again, and have a great day.